Hi, everyone. Welcome. We're going to be talking about acne, and we're going to be talking about what your skin acne can be telling you about your health. This comes from an article by Dr. Jocker. It's about the 10 things that acne means to your health. Today, we have Dr. Udani here with us, and she's made herself available so that if you have questions, feel free to give her a text. I wanted to welcome Dr. Udani with us. She is our resident naturopathic doctor here at Justine Blaney Wellness Center, and she is super passionate on skin conditions, including acne. If you've ever seen her Instagram page, you'll know that she's got lots of great hints. So I wanted to thank her for being the expert at this, and she's going to walk us through. Thank you so much.
Thank you so much, Angela. Good evening, everybody. So yes, like Angela said, acne is one of my passions. And so this is going to be a very informative and fun talk. So some of our upcoming webinars, let's just talk about that first. We have one on kickstarting our Mornings for Success with Dr. Justine coming up. Text neck, and in this new information age, what is it? How can we fix this text neck? And we're also going to be doing 50 stretches with Dr. Justine for her 50th birthday. So that's going to be really exciting to see. And we're also going to be doing an inflammation and degeneration workshop with myself and Dr. Justine. So hopefully you stay tuned for all of these amazing webinars and exercises that are coming up. So as the Dr. Angela was saying, acne is a very a passion of mine because I used to experience acne a lot when I was a teenager and even into my early 20s. And it was just something that, it was so present on my face. So every time, you see somebody, that's the first thing they notice. And it definitely takes a toll on your self-confidence, on your self-esteem. And if you or you know a loved one that experiences acne, you know that it's not just skin deep. Like there's a big mental health component with it too. And so I'm very passionate about holistically healing acne, on my social medias. Although I have a general practice, this is something that is a passion of mine to help others deal and heal their skin just like I was able to. So this is going to be a very, very fun and educational talk. And this is really based on an article by Dr. Jockers about what your skin is telling you. So acne is a sign of skin inflammation, right? It is a symptom of a deeper underlying issue that's going on, and it's almost like a red light or an alarm from your body to let you to telling you to pay attention to what's going on the inside. So you might have known something called face mapping. So this is actually coming from a traditional Chinese medicine perspective on different parts of the face correlates to different organs. And if you notice acne growing specifically on a certain organ or certain certain part of the face, that could correlate to an underlying issue with one of those organs. Of course, now this is educational purposes only. And if you do notice there is a correlation, you should talk to a naturopath, or of course you can talk to me, through my texting or even meet and greet as well to dive deeper into this. So let's go ahead. So what is acne? Because, those bumps can be very, very painful at times. But they can also be really small. They could be really irritating and really red. And so we want to figure out what it is in the beginning. So acne can be very annoying too. And it is basically an infection of a clogged pore. So everybody has pores, everything like our skin, it's composed of pores, among other things. But these pores over time can get clogged by bacteria or dead skin cells, and it can cause the oil to be inflamed and infected by the bacteria and that is residing on the skin. So then over time, this comes up it looks like a bump, and this can even become really swollen and really cystic and really painful, can leave a lot of scarring. So depending on different people and their genetics, their skin type, the diet, lifestyle, all of that can have a big, big influence on how your acne looks. So let's go into one of the things that made me really passionate about acne is realizing that there's a gut-skin connection. So more and more research is showing that there's a clear relation between the gut problems and skin problems. Things like acne, eczema, rosacea can be made worse if you have gut issues. So, especially a gut issue called small intestinal bacterial overgrowth, or SIBO. This is where there's a lot of bacteria growing in your small intestine. This can cause a lot of bloating, cramping, gassy feeling, even brain fog, anxiety, depression. And so, if you have this, you're 10 times more prevalent in people that had acne and rosacea than the group that didn't have any skin disorders. So, there's a big gut skin connection here because so inflammation in the gut drives inflammation on the skin. So, and there's really large studies that show that there's a very high correlation between an imbalance in the gut microbiome. And if you have symptoms like constipation, acid reflux, bloating, like I mentioned, it can show up on your skin too as acne, could be psoriasis, could be eczema. And even there was a study that showed that 40% of those that have acne can actually have low stomach acid. And that's a problem because when you have low stomach acid, you're not really digesting food that well, you're not absorbing nutrients. Other thing is you're actually letting harmful bacteria pass through the stomach into your small intestine where there's so much food that it just grows and multiplies and causes a lot of inflammation. So all of this, what it does is it just stresses the immune system, drives up inflammation, and it tends to show up on your skin too, because your skin is a reflection of what's going on the inside. So there is this is one of the drivers of inflammation that's released by bad bacteria, and it's called LPS. Okay, think of the LPS like little bombs. They're bombs of inflammation going off in your gut. It can go, they can even travel in your blood, and it can even be deposited into your skin too, and that can drive up skin inflammation. So, and this is another study where a healthy group that didn't react to didn't have a reaction, didn't have an inflammatory reaction to the LPS, but more than 50% of the acne patients had a reaction because, they were probably already exposed to this. Their gut was already inflamed. So they were more likely to be sensitive to these bad inflammation bombs, as we call it. So here's another way to explain the gut skin connection. So that way, you might be wondering, like, how is the food that I'm eating, or how is my gut related to my skin? Like, it just, my gut is on the inside, and my skin is on the outside. Like, how is there a correlation? So hopefully this can help you. So basically, it starts with, your mindset, mentality, stress, exposure to stress can make you want to crave unhealthy food, right? Which is very common, right? When we had a long, stressful day, you kind of want to go for the ice cream, go for the cookies, the sugar, or the burgers, takeout. But this food isn't very nutritious, and it can actually dry up the growth of the bad bacteria in our gut. And it's obviously very inflammatory too. Like, we've done so many talks on how inflammatory a poor diet and lifestyle can be. So it can drive up the inflammation in your gut. It can increase bad bacteria, so it drives up even more inflammation. And this inflammation releases inflammatory messengers into the bloodstream that can cause inflammation everywhere else in the body too, including our skin. So let's talk about 10 areas of our skin and what it is telling us about our own health. Now, this is, of course, based on a Dr. Jocker's article. And part of it is also based on traditional Chinese medicine skin face mapping. So if you have acne kind of on your jaw and your chin, just kind of along your jaw area, there's a high chance that this is due to hormonal imbalances. And this can also tend to look more cystic and more painful, more red. And so this is primarily driven by hormones, which can of course be affected by your gut. And so there's also overgrowth of candida, which is a type of yeast that can cause acne in this area. So, and guess what candida loves? Sugar, flour, alcohol can increase your candida too. So, a lot of those things that we go for when we're stressed can be triggering overgrowth of this candida and other bacteria, of course, too. So, even if, let's say, for example, if you've been diagnosed with polycystic ovarian syndrome or PCOS, you might have acne on along the chin and the jaw, and that is also a sign of hormonal imbalance. Lower lip. So this can be an indication of an issue with your digestion and also infections, because right in your oral cavity, your lip around your mouth, like is your very close to your oral cavity. So if you have poor oral hygiene or bad breath, or you know any kind of signs of issues in the oral cavity, that inflammation can really drive up what's going on around that area, right? Because it's like it's not just stays in that one bubble, right? The bubble can burst and can spread all over. So sometimes you might even notice an abnormal color of your lips. That can be a sign of a complication of digestive tract. Now, there could be, so this is according to traditional Chinese medicine. So there could be digestive issues like constipation, even like splitting of the lips or dehydration can cause issues as well. And this is something that if you're noticing acne on your lower lip, which is not a very common spot, to be honest, to experience acne, this is something that you should really get checked out, because it could also be another skin condition like impetigo, which is where this yellow crusting can cause. It could be because of low vitamin B3, like niacin, can cause cracking on the lips. So if you're noticing these things in around your lips, it's something that should be seen as a warning sign to go get checked. The tongue. So yeah, if you knew, there you can definitely notice bumps and things like that on your tongue as well. Now, of course, you're not likely to see acne on the tongue. It might look more as a bumps or cysts. It's not going to look the same presentation as on the face, but but the tongue can tell a lot about what's going on the inside, according to traditional Chinese medicine. So for some of my patients, I do ask them to stick out their tongue so that I can check what's going on the inside. And if you have a white tongue or spot, that could be a yeast infection. Like candida can cause a thick white coating. You can also get this thick or just white patches in the oral cavity. That could be a sign of candida or yeast. And with traditional Chinese medicine, if the tongue is white, that tells us it's congested. So there's a lot of congestion going on. And with acne, that's a sign of congestion. Like things are moving, things are just staying in they're sluggish and staying in the same place. If it's red tongue or there's spots, there's there could be anxiety going on. There could be overthinking. Too much heat can also be a sign of a complete redness. So these are some of the things that as a naturopath, I look for to see what's going on overall in the body. If you experience acne on the cheeks, now this is a very common spot for a lot of my acne patients to experience it on the cheeks. This can be a sign of metabolic abnormalities, could be lung problems or sinus problems for sure. For example, if you notice acne kind of like right in this area, this can also be a sign of rosacea type of acne. And so this is where we want to really assess it, do a proper assessment to rule in rosacea or rule it out. And of course, with the cheeks, this is where we sleep. This is where we, hold our phone to. And so there's a lot of bacteria that, our cheeks are exposed to when we do this too. And so, of course, if you already have an imbalance in the gut and your inflammation, then this exposure can kind of spill over and can result in acne. And so I always recommend, changing your pillowcases, making sure you take your makeup off if you wear makeup every night. Don't sleep on your makeup ever. It can be really, really harmful for the skin. Okay, so let's go to the nose. So depending on if you have oily skin or even dry skin, like your nose tends to have the most of your oil glands. So my skin type is I'm oily skin. So I'm actually oily everywhere, but my nose can be particularly more oily, and you can even see things like whiteheads or blackheads on your nose, and that's just dried up oil glands. They kind of gotten a little bit more solid. So if you notice breakouts in the nose and the cheeks, like I said, it could be because of sinus congestion or exposure to toxins. Of course, poor diet, indigestion is another sign of acne on the nose as well. You can also get acne because of, especially in the nose, because of a diet lacking in healthy fatty acids, healthy fats. Because if because the nose, the T-zone area is where most of the oil is produced. If the oil doesn't have the right building blocks to be produced in the healthy way, it's going to tend to be more pore clogging. So having more healthy fats like avocado, salmon, flax seeds, olive oil can help with reducing acne breakouts really overall everywhere in the body too. Beneath the eyes. So if you notice acne kind of around and beneath the eyes, even these little bumps, we call them milia. So this can, according to traditional Chinese medicine, can be a sign of abnormal kidney function or even abnormal liver function too, especially if you have puffy or swollen lower eyelids. And in traditional Chinese medicine, the kidneys are considered the life force, okay, the essence. So if you notice that, you tend to look more tired, more sunken, the eyes tend to look more like sunken in and things like that, then there might be something deeper that we need to really address, that the acne and everything is showing. The eyes. So, things like styes, for example, if you chronically get styes, or even if you get acne in the eyes, which is very rare, to be honest, to see that. But if you tend to experience a lot of that, that can definitely be a sign of poor liver function, because the liver is where we detox, right? A lot of our toxins and the nutrients, we metabolize that. And with the traditional Chinese medicine, your liver and your eyes are connected. So if there is liver imbalance, it tends to show in the eyes, like red eyes, or headaches. And so there's definitely could be a correlation with acne in the eyes with the poor liver function. So let's go into the skin between the eyebrows and temples. So this is the right, yeah. So I'm trying to, yeah, right in this spot. So this is a spot where our gallbladder acupuncture channel. So if you are, if you do acupuncture, if you're familiar with acupuncture, there's different meridians, which are called channels of the different organs that run in the body and in the face too. So this right in this spot is where the gallbladder channel runs through. And so if you notice a lot of the bumps and acne in that spot, in these spots here, that could be a sign of a sluggish gallbladder that we need to fix. And of course, with the gallbladder, it gets stressed out when we have too much processed foods, too much alcohol, high inflammatory fats, and that really affects our gut, and it tends to show up on our face too. So what about the other side between the eyebrows? So in between the eyebrows is another spot that is actually related to your stress in traditional Chinese medicine. So if you have a very, very, very stressful work situation or things like that, of course you might get acne everywhere in the face. But if you specifically notice it kind of in between your eyebrows, that can be a sign of stress affecting your skin. Forehead. So this can be very common, forehead acne. And I used to experience forehead acne for a long time, and it didn't actually have that typical acne presentation. It almost looked like, for me, it was like these small little bumps. So that is where, this could be caused by bacteria, or it could be caused by other factors, things like yeast or fungi that can cause acne too. So it's important to talk to a health professional to kind of rule out what it could be, that way you can get a targeted approach to what's happening. So with the forehead, that's really related to your digestion, your small intestine, and so if there is a imbalance there, it tends to show up on your forehead. So those are some of the face mapping suggestions for acne, and how where your acne is on the face could be a sign of what's going on inside. So let's talk about strategies to reduce acne. So we're going to start off with hydration. So I'm sure you just noticed me. I'm drinking my water every time. I always have it like within my eyesight, because especially in the summertime, or even when you're not, even when it's cold, like we have to make sure we drink enough water. So one of the best ways to figure out how much water you need is a calculation you can do. And that is, you want to get your weight in pounds and divide it by 2. And then whatever you get, that's the amount in ounces that you should be drinking every day, just regular. If you're working out, you want to have more than that. So one of the other ways that you can increase is you can flavor the water with fruits and veggies, things like cucumber. You can add lemon into it. You can have, I always start my day off with a glass of room temperature water, just to kind of kickstart my digestion, uh, just to wake up my body. You can always think about water first. Instead of going for soda or Pepsi, think about water first. And a lot of times when you're hungry, the hunger is actually not hunger, it's thirst. So you're just you've been thirsty and you just need the water. And you want to be drinking water continuously. At least every 30 minutes you want to be infusing your body with water. And sometimes, this could be hard for someone that's not used to drinking water. So I always say, start with one habit. Start with changing one thing about your water, and then add different things on as you get better at drinking water. Number 2 is good hygiene to heal acne. So this is where, you want to avoid touching your face, right? If you have active acne, you don't want to keep touching, keep poking, because that's just going to introduce bacteria into your face that can cause the infection to get bigger, and also can make it spread into other areas, the nearby areas in the face too. So you can use antibacterial soaps, things that have antibacterial soaps, antibacterial, like things like benzoyl peroxide, tea tree oil, that can help kill any too much of the acne causing bacteria. You can even use, so I have a little bit of caution when you're using essential oils. Please test first, and please dilute as well, because if you use too much, too strong, that can make things worse too, especially if you have sensitive skin. And if you use things like gentle cleansers, for oily skin, I recommend using a foaming cleanser, something that foams, so it can really get in and clean the oil out. If you have dry skin, I recommend using a milk toner or a creamier a toner, because you don't really need to strip away so much oil, because your skin is already on the drier end. You can use gentle exfoliating scrubs like lemon and coffee grinds, on problematic areas. You can use a little bit of bentonite clay to dry out excess moisture, excess oil from the spots. And please regularly clean up your makeup brushes, your phone, your pillowcases, anything, because everything that if you don't clean it up, it can grow bacteria. Another one is having an elimination diet. So an elimination diet is a great way to reduce inflammation quickly, because we want to reduce inflammation in the gut, right? And when that happens, it reduces inflammation on the skin. So with an elimination diet, you do want to cut that food group out for as much as you can. I know no one's perfect, but as much as you can, for at least 2 to 3 weeks. So some of the biggest triggers for acne is sugar, dairy, and eggs, and gluten for certain individuals. But dairy and sugar are the top ones. So just eliminating dairy alone can be a big reduction in that inflammation. And nowadays there are so many different delicious alternatives that you can add, so that you still get if you have that dairy craving, you can still have that. But an elimination diet is a great one. This is, of course, where you can have support. You can have someone in your team to help you go through this to really figure out, okay, how far should I take this elimination diet and how many other things do I need to eliminate? Strategy number 4 is consuming more antioxidants. So because there's so much inflammation, like I talked about earlier in the talk, with the inflamed gut, inflamed skin, and you might even see it on your face, right? If your face gets really red, if the acne is super painful, really big, swollen, those are signs of inflammation. So we want to really, really boost all the antioxidants in your body, because these antioxidants are like little firefighters that go in the body to really wipe out those inflammation fires. And a lot of times when we are stressed and we're not eating properly, all of those little firefighters are getting tired. They need backup. So we need to give more antioxidants into the body. So things like good diet, right? Rich in berries, rich in veggies, healthy oils, reducing your stress, going for a walk, meditation, doing something you love to do, bringing joy into your life, exercising, things, and helping with your liver support. So things like supplements to help with glutathione can help with increasing the antioxidants in the body. Strategy number 5 is we want to make sure we improve your stomach acid to improve your acne. So, making sure that we use we do things that support your stomach acid, especially if it's on the weaker side. So, not really having a lot of heavy foods in the beginning. So you can try lots of smoothies, lots of things like that are already kind of broken down. Using ginger is a great way to increase stomach acid, stomach juices to help digest food. Hydrating outside meal times. So what I mean by that is, don't drink water half an hour after you had a meal, because that's going to dilute the stomach acid and it's going to cause your body to not be able to digest food. Drinking very little with meat containing meals, because with meat we need all the support we can get to break it down, because it's a little bit more tougher for the body to break down. So like I said, holding off the water after a meal for about half an hour. You can use lemon and apple cider vinegar first thing in the morning to kind of kickstart the digestion. Eating protein foods at the beginning of the meal, so that way it has some more time for it to digest. And of course, you also feel fuller faster too. Using fermented veggies, things like sauerkraut, kimchi, pickled veggies. Fermented drinks, a little bit like kombucha, but some people notice the issue with kombucha. So I say test it on yourself first, a little bit, and then see how you feel. And eating your largest meal when you're most relaxed, because that's when you're feeling the most, all the digestive juices are flowing much faster. And reducing stress to heal acne. So there's a huge connection with stress and acne. Like, stress drives up oil production on the skin. Stress makes you crave unhealthy food. Stress affects your sleep. Stress makes you, too much stress is no fun, right? It just shows up on your skin a lot. So, we want to, when we're stressed, we tend to kind of not breathe as much, and we take shallower breaths. So we want to make sure that we are breathing in much more slower, and you're taking deeper breaths. And you can even do the box method when you're breathing. So you do, take a deep breath. So you take a deep breath for 4, and then you hold it for 4, and then exhale for 4, and you take another deep breath for 4. So the box method can really help regulate your breathing, and it can also help calm you down and get your body into a rest and digest state as well. And number 7 is improving zinc levels to heal acne. So zinc is an important mineral. It can also be a very important antioxidant too, because it can drive up antioxidant pathways, and it can get depleted when we are experiencing a lot of inflammation. So having adequate levels of zinc is very important, because our body cannot produce zinc on its own. So we do need outside sources, things like fish, nuts, and seeds that are high in zinc, to help with our body sources. But of course, if you have a leaky gut, or you're on medications, or your blood sugar is too high, there's an imbalance or toxin exposure, stress, these all deplete zinc. So increasing or improving zinc levels will help too. This is where you want to test first. Do a blood test to test how your zinc is doing, and then we can see how much is needed. And this is blood test that I, as a naturopath, can order to see where all of your nutrient levels are at, actually, so that way we have a clean slate to start off with targeted therapies that are ready for you. Proper skincare, of course. So now this is where, because acne prone skin is sensitive skin, you want to avoid long hot showers because the heat can sometimes trigger too much inflammation with the circulation and the blood flow. You use healthy cleansing bars that don't strip your skin too much. You want to avoid anything with too much alcohol and perfumes because that can trigger inflammation. Even things that are based with lanolin, toxic ingredients that we just talked about. And there's another great database to see if your skincare products are healthy or are safe for you, and it's called Skin Deep database. And it's a great resource where you can just type in the product that you're thinking about, and it'll give you a rating on how safe or what are the risks associated with it for your skin. So, like I said, proper skincare, it doesn't just end with skin. It needs to kind of be deeper as well. So you want to make sure because your skin is a reflection of what's going on the inside. So you want to eat very, very nutrient dense, rich meals. We want to drink lots of water, and we want to keep your home cool and humid to avoid dry skin reactions. So not too hot, not too cold. You can even, wear cotton clothes whenever possible. So that way your skin's like, there's no friction or irritation, especially if you have back acne. You want to let the back breathe too. Using natural mild detergents. And of course, using safe tools like things like razors, things that, when you've used it for a long time, replace it, with a newer one. So that way it's not containing bacteria that could be aggravating your skin. And moisturizer. So a lot of times, we think, well, if you have acne or if we have a really, really oily skin, then we don't need moisturizers. But actually, we do need moisturizers. Our skin the skin barrier is damaged, and that's why it's producing so much oil, kind of almost to compensate for the lack of moisture. So if we add in a nice non-comedogenic, so non-pore clogging moisturizer into the skin, that can really go a long way to repairing the skin barrier and helping with your acne lesions. So your skin is very important. It is the biggest organ in the body. It actually is a shield that protects you from harmful pollutants, bacteria, pathogens, and it is also a mirror of what's going on the inside. And so this is why it's really important to focus on it, to give it some love, to make sure that it's healing, it's healthy. And the best way to do that is to kind of go inside, go inwards, to go to the root of what's going on with your skin and why is it showing up these signs. And it's really fixing the root cause of the inflammation will go a long way into helping heal your acne. So I hope that was an informative talk for you. And if you have any questions, my phone is there for any questions and concerns. And of course, I'm also available at the clinic for meet and greets and to chat if you like. So we have some amazing upcoming webinars, like for example, one with Dr. Justine, which is going to kickstart our Mornings for Success. There's one on text neck and on this new information age, what to do about it. Dr. Justine is going to do 50 stretches for her 50th birthday. So hope you join us for that. And inflammation and degeneration workshop with myself and Dr. Justine is coming up as well. So I hope that you enjoyed this talk. And if you have any other topics that you wanted to talk about, we'd love to hear from you because we want to give this to you as free information, and hope to hear from you and hope that you tune in to all these talks in the future as well.
Thank you, Dr. Udani, for being with us this evening.
Thank you. Have a good night, everyone.